Hi, I'm John Guardiola. I'm an assistant professor of clinical medicine at Indiana University, here to talk about our recently published article in GIE called Success and Safety of Conventional Endoscopic Resection Techniques for Previously Partially Resected Colorectal Polyps at a Tertiary Referral Center. It's quite a mouthful. We chose to do this study because we get a lot of referrals for resection of colorectal polyps. Most of them have not been manipulated. And when I say manipulated, I mean manipulation with either a snare, a hot snare, or a hot forceps, basically as a resection attempt. A lot of these polyps are biopsied with cold forceps. Some of them are even injected to see if they lift before they get referred to us. But for those polyps, we kind of counted them as non-manipulated. And so we get a lot of these referrals. We've previously published about how there's a lack of information when we get these referrals about the polyp. Sometimes we don't even have pictures of the polyp. But a lot of times our patients show up for a colonoscopy and it might be the first time we're really getting a good look at the polyp. And we try to remove them right then and there. Now we know that previous manipulation of polyps with snare, forceps, etc., can induce submucosal fibrosis, a noticeable fibrosis within just a few weeks. With a lot of fibrosis, some people have thought that you need to use more specialized advanced techniques such as endoscopic submucosal dissection or full thickness resection. And we find that we can use standard techniques with conventional EMR techniques to remove these polyps successfully and safely. Our recurrence rate and our complication rate were very similar between the two arms of the study. Historically, a lot of people have thought that any previous manipulation is an indication to proceed with endoscopic submucosal dissection or even a full thickness resection. But again, like I said, we have demonstrated that the CAP technique, which we'll demonstrate here.
You can see some white here, that there's some scar tissue down on this end of the lesion. So what we're going to do is approach it closely, and then if we can get close enough to it, we're going to try to suck it up into this cap, and then John's going to close slowly on it. And then when John tells me that he feels it, then I'm going to release the suction and we'll see what we have in the snare. So he feels he's got it now, and you can tell we've got a much better piece of tissue here. So I think we're okay to go ahead and remove it. We're using a 15 millimeter snare, which is about the largest that I think is appropriate to use. And we got a nice on-block resection, really with the assistance of that cap. So that's the cap technique for endoscopic mucosal resection.
The other technique that we often use is hot avulsion. So the previous paper that had the largest collection of previously manipulated colon polyps out of Australia, they use the CAST technique, which is cold avulsion with snare tip soft coagulation, where they use a cold biopsy forceps to remove tissue and then burn the area where they did that with the snare tip, similar to when they're doing margin treatment after piecemeal EMR. We often use hot avulsion with hot biopsy forceps, which we'll demonstrate here.
To use avulsion, we use hot forceps open. This is our only use of hot forceps in colonoscopy, is to perform hot avulsion during EMR. And close slowly, Ryan, and we're trying to get a hold of the tissue, but not grab a huge amount of tissue. So step one is to grab the tissue. Step two is to tent it to get away from the wall. And then we're going to tap the cutting current low voltage on endocut I. And we just tap. And you can see that we've peeled the tissue off and exposed the submucosa. So that's correct use of hot avulsion.
So it will be difficult to compare techniques for previously partially resected colon polyps. I don't know if a randomized trial will ever be done. And each individual endoscopist has their preferred techniques, and we just wanted to demonstrate that using standard techniques that are available, low cost, easy to access, are successful and safe to do. So I hope you'll take a look at our paper and enjoy it.